SPARK is a program brought to you by the International Center for Investigative Reporting, supported by the International Budget Partnership IBP, to tackle pressing issues in our nation around unequal maternal health care services, gender-inclusive agricultural support for small-scale women farmers, access to loan, among others. I'm your host, Blessing Ebireri. Everyone deserves access to quality health care. But for millions of Nigerians living with disabilities, that access is still a daily struggle. Stairs where there should be ramps, no sign language interpreters, and long distances to clinics, the list goes on. Joining me now to share expertise on the topic, ensuring health equity, how Basic Healthcare Provision Fund can guarantee access for persons with disabilities, is Abdullahi Yahaya Danja, National Coordinator, Nurse Leaders for Community Healthcare Initiatives, and Favor Hajara, the Chairperson, Voice Person with Disabilities Community of Practice. You're welcome to the program.
Thank you for having me here.
Thank you very much. It's a pleasure to be here.
And to your esteemed listener, the telephone line to make your contributions are 0915 091 0482 or 0915 091 0483. You can send your questions on WhatsApp to 0810 250 7579. I'll take that again. 0810 250 7579. We're also live on Facebook at the ICIR. Don't forget to include your name and location. And let's delve into what we have for today. Favor, I'll be starting with you. Can you tell us some of the major challenges persons with disabilities face when trying to access healthcare in Nigeria today?
Okay, thank you very much, Blessing. So as we all know, persons with disability faces a lot of challenges when it has to do with healthcare, especially women and girls with disabilities.
Okay.
You know, inaccessibility of our healthcare facilities, it's one of the major challenges we are facing.
Okay.
So as a lady with disabilities, our healthcare facilities lack a lot of accessibility features.
Okay.
Such as the sign language interpreter, which you earlier mentioned. You know, the ramp are not there, and even if you eventually see the ramp, they are type of suicidal type of ramp. Then the accessible restroom that persons with disability can easily access, especially for the wheelchair users. Then even the pregnant women with disability who are pregnant, adjustable bed for maybe delivery time, or maybe a weight checker for if you want to check their weight and all that. These are some of the barriers, the lack of accessibility features, a lack of assistive devices that are not in our healthcare facilities. Yes, lately the Federal Ministry of Health, they are trying a lot to see how policies can be in place to accommodate the issues of persons with disabilities and also to implement them, but there is still significant barriers that are facing persons with disability nationwide. So we are in the capital city of Nigeria. We can only see what is happening within the capital city. And a lot is really happening in the capital city. But when we go down to the rural areas, how do we manage up? Those in the rural area, how do they manage up to access healthcare facilities? Let's not even talk about the attitudinal barrier of healthcare workers, those that doesn't even know how to attend to persons with disabilities because they lack the knowledge of how to attend to persons with disabilities. You know, the way you attend to persons with disabilities is different
totally
from
different
the way. Yeah. So some of the healthcare workers, they feel we are not entitled to some of these healthcare benefits. Me as a lady with disability, there are some facilities I will enter and I will be questioned, why do I come there? And there are some that I will enter and it will be like, just be on the queue. Meanwhile, there is even a legislation that is signed by the government of Nigeria, the Discrimination Against Persons with Disability Prohibition Act, that states that every facility, it did not say some, every public facility should be accessible. And there was also a 5-year moratorium which has already passed since last year, but up till now, we still have significant barriers facing persons with disabilities when we talk of accessing healthcare facilities.
Thank you for that one. Abdullahi, for a listener who may not be familiar, what exactly is BHCPF and its main goal?
Thank you very much for bringing us here and for opportunity to throw more light on some of the issues raised.
Yeah.
As you know, basic health fund for people with disabilities, it was a financial provision made by the federal government from the consolidated fund to assist developed, especially the primary healthcare financing, to ensure that people with disabilities have access to quality healthcare services. So the fund is an act that ensures that money is removed directly from the consolidated fund to care for the primary, especially the primary healthcare centers, to ensure that people with disabilities have prompt quality access to healthcare services.
Okay. Favor, you mentioned some barriers, and now what ways can this BHCPF fund specifically address the needs of persons with disabilities?
Now, thank you very much. You see, like Favor said, when we look at disabilities, there are two main categories of disabilities: mental disability and physical disability. Now, when it comes to physical disabilities, where the issue of structures are required to move to ensure that people with physical disabilities have prompt access, have access to entering buildings, is one area that the structures, the hospitals we have presently, they don't have those type of ramps where on their own, people with physical disabilities on their own can walk in without being assisted by other people. Now, the challenge therefore is that we appeal that constructing structures in primary healthcare, people with physical disabilities, they should be considered when an architectural design for facilities are being put in place. Now, some of the challenges, again, like she said, was the issue of discrimination. Many people, even right from the home, from the birth, there are parents who think that they want to keep their children that have physical disability away from the public, okay, to the extent that they don't even want them to go to school. And that, again, from beginning, will begin to create an obstacle to a disabled person having information. For example, now there are a lot of things that are going on online that they put online to educate people. A disabled person who the parents from birth decide to keep away from going to school is already having a challenge. Apart from the physical challenge, he has also now been mentally being disadvantaged. Because the fact that one has physical disability does not necessarily mean that he has a mental disability. Okay, so this fund that is being made available now, it should ensure that it's not just about health, it should also be about educating people with physical disabilities, to ensure anybody with physical disability is brought out, is not kept hidden in the house, and he should be well educated, so that even when he go to the hospitals, he should be able to interact. For those that can speak and can hear, they should have sufficient knowledge to explain themselves to the healthcare providers, and those that cannot speak, they should have a trained sign language interpreter that will assist them to communicate their issues to the healthcare providers. Now, if this fund is properly utilized to care for these basic needs, I think people with physical disabilities can also be adequately cared for in our healthcare facilities.
Yes, you wanted to add something,
Okay,
Favor, yes.
Let me quickly add something to that. So when we look at disability critically, disability is a wide spectrum.
True.
That cuts across a lot of areas. Now, when we talk of types of disabilities, We have various types of disabilities.
Yes.
And our needs are
different. Yes.
Yes, very, very different. Me, as a lady with physical disability, my need is different from a lady with albinism.
Okay.
Now we have the deaf, we have the blind. Now the way you attend to a lady with albinism is different from the way you attend to a lady with physical disability.
Okay.
And the way you attend to a lady who has low vision or who is totally blind
True.
is different from the way you attend to the lady that is deaf. And let's not also forget that there are also some disabilities that are visible and there are some disabilities that are not visible.
True.
So when we are able to get these statistics properly, then you will be able to know what technology to put in place, assistive device to put in place to assist this set of disabilities. Now, disability is a general word that cuts across everyone. We have the dwarfism, we have the physical disability, we have the spinal cord survivors, we have the amputee, we have the albinism, just I've likely mentioned, we have the deaf, we have the blind all together, and we have the psychosocial also.
Okay.
Then we have the intellectual disabilities also, which we classify as the children with special needs.
Yes.
That comes with children with autistic or Down syndrome and all that. Now, this everybody, if you want to plan, you have to plan to make sure that everybody is carried along. Now, in the healthcare system, if I want to really solicit or want to suggest or advise, is to make sure that we know the types of disabilities, know their peculiar needs, because every one of us have a peculiar need. They know how to put those needs in order. Accessibility goes beyond putting ramp in buildings or making your toilet wide to make sure that a wheelchair user is able to access. What of the blind? Are you able to make your documents in Braille so that the blind are able to read? Because the blind cannot read what you are writing in English. It has to be in Braille. Then for the deaf, are you able to provide sign language interpreter in every of the primary health care to make sure even at the rural area everybody is able to access without any barrier? Then for the staff, the healthcare personnel, are you able to give them a quality, inclusive and accessible training to make sure they attend to persons with disability without any form of stigmatization, so that we are able to go to any healthcare facilities?
Sorry, please, can you hold that thought? We have a caller.
Okay.
Hello.
Hello, good evening.
Good evening. What's your name and where are you calling us from?
Yes, please. My name is Maria and I'm calling from Port Harcourt.
You're calling from Port Harcourt. Thank you so much. What's your question?
Please, I want to know how this biggest barrier that the person with disabilities currently face in accessing healthcare services.
Oh, okay. Biggest barriers. Okay. Thank you so much for calling.
Okay, thanks.
Say she wants to know the biggest barriers people with disabilities face, so you can take that answer.
So like what I was explaining is part of the barriers. So if we're able to attend to each of our peculiar needs, then you are able to carry everybody along. Providing sign language interpreters, making sure that your prints are large enough for a lady with albinism to read. Then your documents are printed in Braille, not just in English, or you have the audio version that the blind person can listen to, or even if it's in English, something that you can send to the blind person that with their assistive devices, they are able to use their screen reader to read it without any form of interruption and all that. I think these things are, if they are being put in place, it's going to go a long way.
A long way.
Yes, in making sure that persons with disabilities access healthcare facilities without any form of discrimination
or stigmatization, like you said.
Yes. Then one of the biggest barriers still remain the inaccessibility to healthcare facilities, and the attitudinal barriers of healthcare workers, because they felt most times that, especially when we ladies want to access sexual and reproductive health care in the facility, they felt, we as a lady with disabilities, I don't have access, I don't have rights to decide for my sexual and reproductive health and right. It's not like that. Let me decide what I want and what I don't want. If I want to get married, it's fine. At least I'm a human first before my disability. So don't even consider my disability first before my being a person. So our biggest barrier in accessing healthcare facilities is still remains the attitudinal barriers of healthcare workers and also the lack of access to services.
Okay, thank you for that. You're tuned to the network service of Radio Nigeria, and the program is Spark, brought to you by the International Center for Investigative Reporting and supported by the International Budget Partnership. We have been discussing ensuring health equity, how BHCPF can guarantee access for persons with disabilities. We'll go on a short break now. When we return, we'll be taking your calls for questions and contributions. Please stay tuned. This is Spark on the network service of Radio Nigeria, brought to you by the International Center for Investigative Reporting. We have been looking at ensuring health equity, how PHCPF can guarantee access for persons with disabilities. Abdullahi, I'll come to you now. How can we ensure that persons with disabilities are included in the planning and monitoring of PHCPF projects?
Thank you very much. Just like before have said, now if we actually want to make adequate health
Please
provision,
can you hold that, or we have another caller? Hello? Hello? Okay. You can
now
go ahead.
we've heard that some monies have been made available to the people to ensure this program is carried out. You talk about 30 something.
32 billion naira, yes.
Now, people mention some certain things as somebody who is directly involved.
Okay.
Now, these health facilities, under the normal circumstances in our health facilities, we have specialist hospitals, we have federal medical centers,
Yes.
we have orthopedic. Now, is it not as a group that we have identified these special needs? If we must ensure that they get access, then we must set up special need hospitals where all the things she has mentioned. Because if we scatter all our eggs or all our thing in all the hospitals, then the challenge of having quality care. But if we say, for example, in each zone of Nigeria, you have a special hospital for the blind, a special hospital for orthopedics, a special hospital for because in the general setup, this is what we have in Nigeria. We have psychiatric hospitals, we have orthopedic hospitals, we have specialist hospitals for normal people. So the disabled, the people with disabilities, it will not be too bad if we have trained staff, special equipment that will take care of their need in some particular. For example, in Abuja here now, we have about 6 area councils. There is nothing stopping us in each area council to have a hospital that is designated, say, for the people with vision disability.
Yes.
We have another one for orthopedic disability, so that all the equipment that we care for such type of people will be in that hospital. And then the workers themselves will be so trained, because you have been talking about the attitude of workers. These workers will be specially trained, not just the generalists now, will be specially trained to handle this peculiar.
Sorry, we have another caller. Hello? Hello? Okay, we can go on.
Now, having established these hospitals, we are also aware that in Nigeria, when you just bring funds and throw it into the system, it gets swallowed up without any accountability. So for the physically challenged people to be involved, there must be community groups that, okay, this hospital we are setting up for social program, how much is being allocated to it? How are they going to monitor it? Is it the building you are building? Is it equipment you are buying? The people, these should not be government officials. They should be part of the consumers of these facilities, the village heads, the clubs, okay, that are going to be part of those that are going to be monitoring the fund. Because in Nigeria we find a situation where even non-existing facilities are being allocated money. And nobody is monitoring it to find out whether this money is actually being utilized for what it is being used for. So for the fund to be actually being properly utilized, there must be volunteers, community volunteers with people with disabilities as members who will say, okay, we are building forums for a social year, and these forums are actually built. he mentioned brails and some other facilities that are peculiar to physically people with physical disability.
Yes.
Okay, we are going to buy 10 brails, and then for this year we are buying 10 brails, and that budgeting is made. And somebody, this monitoring group, this community accountability group, the money is announced. This is how much we are going to use, and this monitoring group will ensure that that thing that they say they are going to do will be done. Otherwise, as the money comes, so it will go, and many of those things that is required will not be done. So people with disabilities and other members of the community should be the people that are going to monitoring whatever projects that they want to do. And like I said, we must begin to provide specialist hospitals for people with disabilities, taking care of, for example, visually impaired. This is where they can get their own access. And all the facilities that for vision impaired people will be there. Is it for an orthopedic person that have orthopedic issues? This hospital is for orthopedic, so that, because if we don't do it that way, if we begin to do it the way we do our normal things, you will discover that a visually impaired person will go to where he will get
proper access to care.
Proper address. And even the personnel is talking about, because a healthcare personnel is a specialized area. If he's not trained, he don't know how to handle the issue. So this fund must make provision for training, not just for the health workers, but also the people with disabilities. Because like I said, there are people whose parents and the issue don't even want to go to school. So if government identify that, okay, in this family there are people who is disabled and the parents are preventing them from going to school, we need an advocacy to say, no, a disability, physically disability person does not mean his mental is disabled. Even when you have a mentally disabled person, it can still also be assessed, like you talk about the albinism and other type of mentally disabled people. They can be trained for other physical activities to be carried out. Okay. So these are the areas that I think the funds should be properly utilized and monitored for accountability.
Thank you so much. Favor, how can PhCPF address the unique needs of people living with disabilities?
Okay, thank you once again. So let me quickly correct that terminology.
Okay.
Is persons with disabilities
okay.
or people with
disabilities. Okay.
Yes, so that living is usually not there.
Okay.
Because disability is
it's
not a disease.
True.
Yes, so thank you.
Okay.
So the unique needs, addressing needs, just as he has said, we have a general body. You know, when the law was passed in 2018, the Discrimination Against Persons with Disability Prohibition Act, there was also a commission. And we have the executive secretary of the commission that is under the Federal Ministry of Humanitarian. So monitoring and accountability can actually go through that route.
Okay.
Yes. Then also involving them to make sure that equal access, it's also a very important a very important part of it, because for what I know, the commission have not everyone, but at least everybody can be carried along, and they are able to attend to with whoever organization that this budget is coming through, to make sure that they involve everyone for they involve everyone in the healthcare facility, in the healthcare sector. So to this extent, we can say that the commission can be carried along, so that from there they can have every information they need to make sure they reach even to the rural areas.
Okay.
Because this is not to the urban or the cities or just like that. The rural areas need to be carried along to make sure everyone have access to quality healthcare. Yes.
So finally, what actions would you recommend to government, health institutions to make life better, to make accessibility much easier?
Okay, so for me, I would say that having the issue of inclusion and accessibility, it's not for government alone.
Yes.
Disability is everybody's business.
True.
It can happen to anybody at any time. So it's everybody's business. So let's not just say it's federal government alone. Everyone should be involved. So in any way, any area we are having our activities, our programs, even in our homes, let's stop discriminatory. This discrimination act that we put up, let's stop it. Then the stigmatization, and let's stop it. And if we have opportunity of learning, let's also learn. Like Adan here mentioned a family is not bringing their children out because of the child has disability or that. Most of them is because of discrimination from the society.
True.
So the society should be fair. Let's see ourselves as human beings first before our disability.
Hello?
To make sure.
We have another caller. Hello, good evening. What's your name and where are you calling us from?
Good evening. I'm calling you from Suleja. My name is Adam West.
Adam, okay. What's your question?
Adam West. Hello?
Yes, I can hear you. What's your question, please?
I simply want to contribute small contribution here.
Okay.
The contribution is that sometimes the government have a lot to do. Because if in some countries, even their money has some kind of braille sign. At the moment a blind man touches the money, you know how much it is. You know which amount of money he's touching, currency he's touching. But in this country, the government is not even giving some building consideration. The issue of RAM, the issue of even where wheelchairs can climb, and there are so many other things that are lacking in the area of physical challenge our members. We should see, so the government is supposed to be. We have ministers. So my own contribution here is that some of the physically challenged people should be involved in the decision making, so that they will be contributing in the problem they have. So that the government should be telling the government, because some of them are learned, like my sister that is there. He has said it all. We go help Nigeria. Thank you.
Thank you so much for calling all the way from Suleja. He said people with disability should be involved in decision making, so that at least people that are at the hems of affair will actually know where it pinches.
Yes. At least to acknowledge the word that says nothing about us without us.
Yes. So thank you for joining us on today's program, Favor and Abdullahi. So listener, ensuring health equity isn't just the government's job, it is shared responsibility. Communities can speak up, monitor how PhCPF funds are used, and demand inclusion for everyone. Many thanks to the studio manager Priska Opara, the producer Vivian Onowewari, the engineer Roseline Aduko, ICT Jonathan Aina, and the ICR social media team led today by Israel and Vincent. I am Blessing Ebireri. Still on the network service of Radio Nigeria. Next